So we look into today's lectures, understanding the contribution of public and health provision in the provision of health and social care services. We would have to look into, to start with, the specifications just bear with me. So let's look at what we intend So unit 4 today, we are going to look into how to examine the national and international socio-political issues in the promotion of public health, analyze the role of health promotion in determining healthcare services demand in national setting, evaluate the impact of international campaigns and national policies on the demand for healthcare. These are the areas you are going to cover, and I expect that you join with me with this aeroplane as we get to our destination. All right. We would have to look into, to start with, outcome 4. 1, 2, 3, and 4. Here. So, what does health promotion action means? Health promotion goes beyond healthcare. It puts on the agenda of policymakers in all sectors and all levels, directing them to be aware of the health consequences of their decisions and how to accept responsibility for health. Health promotion policy combines diverse but complementary approaches, including legislation, fiscal measures, taxation, and organization change. It is coordinated action that leads to health, income, and social policies that foster greater equity. Health promotion policy requires the identification of obstacles to the adoption of healthy public policies in non-health sectors and ways of removing them. The aim must be to make the healthier choice the easier choice for policymakers as well. So let's look at the conceptual framework for health promotion. What then will be the contribution of public health promotion in the provision of health and social care services? A core function of public health promotion supports government, communities, individuals to cope with and address health challenges. This is accomplished by building health public policies, creating supportive environment, and strengthening community action and personal skills. So these are what we have to also look into: the health promotion, historical evaluation or evolution. Health promotion is not a new concept. The fact that health is determined by factors not only within the health sector, but also by factors outside was recognized long ago. Specific cause of most diseases was diseases to be, but there was an acceptance that as poverty, destitution, poor living conditions, lack of education contributed to disease and death. According to William Allison's report, 1827 to 1828, an epidemic typhus and relapsing fever, Louis Venus report 1840 on severe physical and moral conditions of the workers employed in the cotton, wool, and silk factories. John Snow's classic studies of cholera, 1854, etc., stand testimony to this increasing realization on the web of disease. Let's move a bit further from this. This is just on history. Where we could also look into certain statements that health was promoted by providing decent standard of living, good labor condition, education, physical culture, means of rest and recreation, and required the coordinated efforts of statesmen, labor, industry, educators, and physicians. It founded reflections 40 years later in the Ottawa Charter for Health Promotion. Around the same time, the twin casualty of disease was also acknowledged by J. Harrell, the first professor of social medicine in Great Britain, which also drew attention to his applicability to non-communicable diseases. Health education and health promotion are two terms which are sometimes used interchangeably. Health education is about providing health information and knowledge to individuals and communities, and providing skills to enable individuals to adopt healthy behavior voluntarily. It is a combination of learning experiences designed to help individuals and communities to improve their health by increasing their knowledge or influencing their attitudes. Whereas health promotion takes a more comprehensive approach to promoting health by involving various players and focusing on multi-sectoral approaches. Health promotion has a much broader perspective, and it is tend to respond to developments which have direct or indirect bearing on health, such as inequalities, changes in the patterns of consumptions, environments, and cultural beliefs. We have to then examine national and international social political issues in the promotion of public health. National social political issues, healthcare funding. The level and distribution of national funding for healthcare can significantly impact public health promotion. Budget constraints can limit the reach and efficacy of health campaigns, screenings, and other preventive measures. Political priorities. Governments might prioritize certain health issues over others based on the current political climate, public opinion, or economic considerations. For instance, a government might prioritize combating infectious diseases over non-communicable diseases or vice versa. Cultural norms and values. Cultural beliefs can influence health behaviors and perceptions. For instance, in some cultures, mental health might be stigmatized, making people health campaigns about mental health being challenging. So these are three areas that we could look into. One is healthcare funding can be a social political issues, political priorities, and cultural norms and values. This can be all areas of concern. Then we can look into the healthcare infrastructure itself. Quality and accessibility of healthcare and accessibility of healthcare infrastructure like clinics and hospitals influence the effectiveness of public health initiative, which is very important. how an infrastructure is built or hospitals can influence public health. Education literacy. Education level can impact public health understanding and reception of health messages. Higher literacy rates usually facilitate more effective health promotion. Media influence. The role of national media, including news outlets and social media platforms, is crucial in shaping public opinion about health issues. Sensationalizing or misinformation can either public health effort. So the role of media plays a major role in propagating public health functions and its roles and what they have for the citizenry. Public health diplomacy. International relations and diplomacy can affect collaboration between countries or public health issues, especially during global health crises like pandemics. Very important. International regulations and agreements. Treaties like the Framework Convention on Tobacco Control can influence national public health policies by setting international standards. Economic disparities, globalization and trade. Economic disparities between countries can affect their ability to invest in public health. Low-income countries might struggle to fund essential public health initiatives without international aid, which is key. So these are middle-income organizations or low-income will definitely struggle when it comes to situations like that. Migration and population movement. Migration, whether due to conflicts, economic reasons, or climate change, can introduce new public health challenges, including the spread of diseases and the need for healthcare in refugee camps. Then the IOM, the International Organization, NGOs, organizations like the World Health Organizations and various NGOs play major significant role in shaping public health policies, offering guidance, funding, and expertise. In general, we can say that social political factors, both in national and international levels, these factors can shape direction and priorities and effectiveness of public health campaigns and interventions. At the national level, understanding the cultural nuisance, the social political priorities, and infrastructure realities can help tailor public health initiatives to more resonate and impactful. That's what it means. In understanding these norms, it would help. And then in essence, promotion of public health isn't just about medical knowledge. It's not just about that. But addressing public health challenges, therefore, requires an holistic approach to that considers those social political dimensions. You understand? These are key things that we have to look into. We have to look into. Then we need to look into how to analyze those roles of health promotion in determining healthcare service demand in national setting. To start with, we could say health promotion plays a crucial role. However, what are some of the components that they seek to address? One is to disease prevention. The campaigns of health and public health help towards disease prevention, such as vaccination drives, screenings, hygiene practices, and all that. The impact, therefore, will be that effective disease prevention reduces the need for treatment services related to those diseases, thereby decreasing the demand for specialized healthcare services. 2. Lifestyle changes and chronic diseases. Health promotion initiatives often emphasizes the importance of healthy lifestyle, including physical activity, balanced diets, and abstaining from tobacco and excessive alcohol consumption. The impact, therefore, will be that by promoting this healthier lifestyle, the incidence of lifestyle-related chronic diseases like diabetes, heart diseases, and certain cancers can be reduced. This subsequently decreases the long-term demand for treatments related to these conditions. Early detection and treatments. The role of that health promotion campaigns that emphasizes the importance of regular checks up and screening can lead to the early detection of conditions, making them easier and more cost-effective to treat. The impact on demand will be, while there might be an initial increase in demand for screening service, early detection can lead to more effective and less intensive treatments, potentially reducing the demand for more advanced healthcare services in the long run. Health literacy and self-care. Health promotion will enhance health literacy, empower individuals to understand and manage their health better. It's all about campaigning, and the impact on demand will be better informed individuals can engage in self-care for minor ailments and make more effective decisions, potentially reducing unnecessary visits to healthcare facilities. Mental health awareness. As mental health gains prominence in health promotion agendas, there's a push towards the destigmatization mental health issues and promotion available services. Impact on demand will be raising awareness, increase the demand for mental health services as more individuals recognize their needs and seek help. Addressing social determinants of health. The role will be that modern health promotion also focuses on addressing broader social determinants of health, such as housing, employment, and education. The impact on demand will be that by addressing these root causes, the overall health of the population can improve, leading to a reduced demand for health care services. Then we could look into changing public perceptions, public health systems. So health promotion would help in raising those awareness in public health, whereas perceptions will be changed by regular campaigns, education through the social media or media networks. And so the national setting, self-promotion as both a driver and a moderator of healthcare services demand. It only shapes individual health behaviors, but also influencing the broader public perception of health and wellness. Effective health promotion strategies can lead to healthier populations, thereby optimizing the demand for healthcare services and ensuring that those resources are used effectively. In promoting healthcare strategies, it can lead to healthier populations, thereby optimizing the demand for healthcare services and ensuring that resources are used effectively. We have to therefore look into how to evaluate the impact of international campaigns and national policies on demand for healthcare. International campaigns, one is to look into awareness and disease control. An example is the World Health Organization campaigns on HIV and AIDS awareness and prevention. The impact, therefore, will be that such campaigns enhances global awareness about diseases, leading to increased demand for testing, preventive measures like condoms and treatments. This is very key when it comes to international campaigns. We can also look into vaccination drives. An example is the Global Polio Eradication Initiative. International vaccination campaigns can lead to a surge in demand for vaccines in the short term. In the long term, the successful eradication of diseases reduces the demand for related treatments. And then 3, health behavior campaigns. WHO anti-tobacco campaigns. The impact. Such campaigns aim to change individual behaviors on a global scale, reduce tobacco consumption due to these campaigns, and can lead to decreased demand for treatment related to tobacco-induced conditions. 4, global health crisis. Example, international campaigns and adversaries during pandemic like COVID-19. The impact, therefore, is that these campaigns can lead to a huge, significant spike in demand for healthcare services, including testing, treatment, preventive measures like vaccines, and so on. The national policies. Universal healthcare policies. Example, the National Health Policies, NHS England, the National Health Service, NHS in the UK. The impact is universal healthcare system generally increase access to healthcare services, leading to higher demand as more people can avail of services without prohibitive costs. Very key. Health promotion and preventive policies. Example would be the national screening programs for breast cancer or policies promoting physical activity. Such policies, the impact will be that it increases demand for screening or preventive in reduced long-term demand for treatments. Then we have to look into health insurance mandates. Example, policies requiring citizens to have health insurance as seen in some countries. The impact will be that by making health insurance more widespread, these policies can increase the demand for health services as financial barriers to access are reduced. Regulatory policies on pharmaceuticals. Example, policies that influences drug pricing or the approval of generic drugs. The impact is that policies that reduce drug prices or promote the use of generics can increase the demand as medications become more affordable. Health education in schools. Example, policies mandating health and sex education in schools. The impact is that it educates young individuals about health that can lead to increased demand for preventive services and decreased demand for treatments in the long run. Resource allocation and policies. That will be more involving. So research allocation policies. Example, national policies that prioritize funding in certain areas like maternal health or mental health. The impact, therefore, will be that learners are able to look into areas of funding and give attention to increased demand, while others might remain stagnant or decrease information. These are the key. I will therefore say that in conclusion, both international campaigns and national policies play instrumental roles in shaping demand for healthcare services. The impact thereof is that the treatment to the power of organized efforts and policy making in influencing health behaviors and healthcare consumption patterns. For policymakers, health administrators, understanding these dynamics is essential. However, to anticipate these shifts in demand and allocate resources effectively, I would therefore advise that in your search for references, in the UK, we use the Harvard style of references, and you have to reference every single that you take or you pick up in your student submission assignments. What I'll therefore seek to do is that when you send your assignment to me in 2 weeks' time, we'll have to review it and ensure that you are complying to the learning outcomes and assignment brief. I would go over again the assignment brief with you. Today will be your last session, and see you next Thursday and Friday. One key thing that I would say is that you have to compare your national policies to your international. So you look at your country. For those of you from Pakistan and India, you would have to look at your country's policies. Look at your national policies. Then compare that to what healthcare policies can those countries achieve. It could be a universal healthcare policies, your health promotion preventing policies, your healthcare mandate policies, and your regulatory policies. So it could be regulatory in terms of HIV/AIDS or the COVID-19 pandemic. These are all areas that you can look into. However, it is quite imperative to know that you would have to have a bit of resemblance in the international campaigns, vaccination drive, health behavior campaigns, global health issues, awareness and disease control. These are all areas that you can look into and reference to. Example is the World Health Organization's campaigns on HIV and AIDS awareness, or the vaccination drive, the Global Polio Eradication Initiative. These are areas that you can look into in your search in presenting these assignments. Having said that, I will reckon that in the absence of, if you have any questions, you could ask, and then I can answer them, and I might bring today's lectures to an end. I want you to look into your international socio-political issues, the global health diplomacy, international regulations and agreements, economic disparities, globalizations and trade, migration and trade, migration and population movements, international organizations and NGOs. All right. So I would end today's lectures, and some references that you can look into is the Health Promotion Enhanced Wellbeing First Global Conference, the www.ncbi.nmic.gov, www.WHO International, and then you can look into the NHS England website. To be specific, look into the areas of policy formulation. And then lastly, you can look into involving people healthcare guidance. So today we have covered our preliminary. We'll look into further reading with the PAC strategy 2020. Read more about that on your student model, and then read about the NHS role in public health article also in your model. Today is your last lecture. I would expect your student assignment in 2 weeks' time in any email sent to learner@work@ukvarsity.co.uk. All right. Without nothing to be said, I'll meeting to an end. See you guys, and see you guys next week. Okay. All right. Stop sharing. Recording. Stop sharing.